Let us summarize this chapter on restrictive cardiomyopathy. Restrictive cardiomyopathy is caused by a heterogeneous group of diseases. The typical characteristic is primary diastolic dysfunction. Most commonly, the cause is some form of myocardial infiltration, and the typical clinical features are that of right heart failure. Patients with restrictive cardiomyopathy have a poor prognosis. Unfortunately, the diagnosis is often missed, and the typical echo findings include left ventricular hypertrophy, normal or only mildly or subclinically reduced systolic dysfunction, biatrial enlargement, various degrees of diastolic dysfunction, dilated vena cava inferior, and tricuspid regurgitation. Additional findings include pericardial effusion and pleural effusion. Remember, don't confuse restrictive filling with restrictive cardiomyopathy. Usually, it is a combination of the morphology in the echo, the presence of diastolic function, and typical clinical information which leads to the diagnosis. The most common forms of restrictive cardiomyopathy, at least in the Western world, are amyloidosis, idiopathic, hypereosinophilia syndrome, endomyocardial fibrosis, sarcoidosis, and chemotherapy. Each of these different forms shows specific typical findings in the echocardiogram.